Welcome to Medica Nova Wellness Studio. I'm Dr. Angelika Maria Koch with your educational videos about optimal health and the most innovative and holistic approach to your well-being. In our last video of this year, let's explore how you can heal vaginal yeast infections, also called vaginal candidiasis, with natural and therapeutic tools. Millions of women suffer from vaginal yeast infections every year, including painful infections that re-emerge just when you think they're gone for good. Estimates show us that about 75% of all women will have vaginal yeast infections at some point in their lives. So let's tackle this situation and enjoy this video. To stay updated with my ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and family, and don't forget to click that bell as it notifies you every time I upload a new video. So what is vaginal yeast infection? The human body is home to millions of yeast organisms, and many of which are actually considered good as far as our health is concerned. So we eat mushrooms, we use yeast to make beer and bread, and they all play a beneficial role. They even improve our immune system and help produce food, respectively. But the species of yeast responsible for causing yeast infections is a strain called Candida albicans, which can lead to an overgrowth known as candidiasis. But all strains of yeast are actually fungi. Vaginal candidiasis refers to the infection in the vagina caused by the fungus of this Candida category. Now, this fungus is normally present in the vagina, but is almost harmless. However, when the immune system of a woman gets weak, this fungus multiplies and leads to symptoms. It's also known as vaginal yeast infection or vaginal thrush, and we see this inflammation of the vagina and the vulva. So already you get the idea. This is not just a physical symptom. This has to do with your overall health, with your immune system. It's not about just applying creams and taking medication for the discharge and the itchiness. This is about your overall health. So some women struggle with chronic vulvar pain known as vulvodynia. So don't confuse this here. Vulvodynia can lead into vaginal yeast infections, and it has similar symptoms like inflammation of the vulva and the vagina and the redness and the burning sensation. But there are two different aspects here. Now, in case of vaginal yeast infections, Candida albicans yeast first attaches itself to newborn babies right when they're born. That happens due to the normal vaginal birthing process after coming in contact with the yeast from the mother. It's a really good process, right? We need these good microbiomes within our body. It really establishes a good digestive system later on. And normally this happens right at the time of the birth, or in some cases shortly after. Now, by the time the baby is about 6 months old, there's about 90% chance that Candida albicans is present in his or her body. But at that point, it's harmless. Although, the newborn's immune system may be not really fully developed yet, it's still able to function normally and prevent the yeast from growing too much. In a very small percentage of cases, a baby isn't strong enough yet to control the yeast, and then we see it as oral thrush. It's sort of the white patches inside the cheek of the baby. By the way, there's a homeopathic remedy available called Borax 30. It's available at your local health food store or online. It's a godsend. It will take away the oral thrush immediately. I would say 1 tablet daily for 2 or 3 days. Also, of course, contact my practice, health@medicanova.net, for further guidelines here, but that will do it right away. So when someone in general, an adult as well as a child, has a strong immune system that works properly, she's able to maintain a balance between these different strains of microbes, allowing them to fight Candida in a natural way, right, and stay healthy before the problem starts. So we have good bacteria and bad bacteria, and the Good bacteria are capable of balancing the bad bacteria, which means you remain free of infections, digestive disorders particular. There's one common strain of bacteria called Lactobacillus acidophilus, and we find that often in probiotic supplements. It's present within our vagina normally, in just the body provides it, helping to keep other organisms at bay, including the yeast. So the body knows what to do. It has a highest intelligence. It produces the right parts at the right time in our body so we don't get sick if we don't interfere with it. However, this delicate balance can easily become upset when yeast begins to grow sort of rapidly and take over. And this can happen due to different kind of causes. Maybe you just finished a course of antibiotics, right? And suddenly your yeast infection comes back. Your digestive flora is upset. Hormonal imbalances, absolutely, during pregnancy because we have hormonal changes, as well as certain conditions that make it easier for yeast to grow. The Candida albicans, or these other types of yeast, they're basically constantly on watch out for food or food supplies and sources. It's almost like that, as if they speak to each other. They have this communication system among each other and look for sources available and really spread out the information and say, okay, let's go to the banquet here over there is a good food supply. And this makes the yeast gravitate toward that source so it can feed on it and multiply quickly. So the idea is to cut off any food supply, in this case, sugar, grains. We talk about this in a minute as well. To keep on building and growing the colony, yeast and fungi secrete these hydrolytic enzymes as a way of turning indigestible matter within the body into usable food. Just like we humans do, we have enzymes that break down our food so we can assimilate it much better. And this yeast organisms do the same protocol. So as more yeast build up in one area, a type of mold is formed that has the potential to cause yeast infections. So as I said, following antibiotic treatments during pregnancy, you're more prone to it because of the change of the hormones. When someone has hormonal imbalance in general, maybe uses hormone therapy, I would say definitely takes birth control pills. Following sexual intercourse. I'm not saying that women are only affected. Men also can have yeast infections. So there can be maybe a transmission. Of course, when someone has an impaired immune system, is on the top of the list here. Around the time of menstrual cycle, the week before the period, as well the week after, the woman is more prone to it. Check your tampons. Keep yourself clean. It's important here. Anybody who has diabetes, which is not controlled, as well as in general, just bring in a healthy and clean hygiene into your daily protocol. The symptoms, really only come about if you provide the yeast with a certain environment. So it likes moist environments, humid environments, and we found them in the mouth, in the throat, in the genitals, in the armpits, the anal area, maybe your navel, can sweat a little bit, nasal cavities, needless to say, within the ears, the fingernails, the toenails. I've seen lots of fungal proliferation between the toes and between the fingers. It's a nice little place the body likes here, or the yeast likes here, as well as digestive tract, of course. So then when it hits the vagina, you will see itchiness. It's very uncomfortable, very severe. You also see a vaginal discharge. Often it's this thick, white, clumpy, can be odorless, can have a smell with it. It looks a bit like cottage cheese, white cottage cheese. It's very distinguished with Candida albicans. The skin is irritated around the opening of the vagina, the vulva and the labia. There's redness, there's swelling. If it's not treated, there can be even cracks in the vagina, and there's slight bleeding involved, which is very painful. Needless to say, there is pain with intercourse during menstruation, even when urinating, because the urine burns over the cracks. It's a very uncomfortable situation. As I said, some women mention that there's a smell involved, can be a little bit fishy even, but mostly it's odorless. Usually yeast infections are obvious and somewhat uncomfortable, especially if left untreated, and the symptoms continue to worsen. However, some people don't recognize that they have a yeast infection. They think they have a urinary tract infection, or they have sexual transmitted diseases, or there was some effect from the birth control pill. So check that out and be sure that it's a yeast infection. So when Candida yeast multiplies, it's capable of spreading to different parts of the body and causes therefore all types of problems and symptoms. So the Candida albicans in the genital can then move to the digestive system, and then we have a really more chronic situation. And it is like a form of then an internal digestive yeast infection and causes symptoms which are too long to share here in this video. It really affects the entire beingness. Often I see patients with memory loss, fogginess, brain fogginess, right? They can't function during the day anymore. Needless to say, their digestive system is upset. Changes in appetite, in food cravings. But really it affects the entire totality of the person, right? The mental, emotional, as well as physical aspects. So if you're interested in a health consultation, either for yourself or your children, contact me at Medica Nova at health@medicanova.net. Medica Nova, or New Medicine, is my practice for integrated and educational medicine, and we offer a unique blend of natural and cutting-edge therapeutic tools from homeopathy, iridology, sclerology, systemic herbology, advanced biofeedback, and health and wellness coaching, and so much more. So book your appointment today. Before I share with you the natural treatment protocols, I would share with you some food for thought. My favorite part of any video. It's the metaphysical meaning behind any physical symptom. Maybe there's a story, right? Maybe there is some tension behind you experience, not just on the physical level, the vaginal yeast infection, but also on the mental, emotional. So the food for thought part in this video should give you some inspiration to look beyond the physical symptom. I always refer to Chuck Martel, who says there are several sorts of Candida. He said the most frequent form in humans is Candida albicans, and though it may be found both in men and women, it is most often mentioned in women. Candida is a Latin word and it means white. That's why we see this white and crusty yeast that manifests itself following a disorder of the vaginal flora. The bacteria of the vagina normally control the Candida, but in this situation, suddenly it changes. We want to see what thought patterns are behind it and why it changes. So this infection is naturally related to my commitment to myself or to my partner, involving my sexuality or any undiscussed situations, expression, and emotions following certain previous personal conflicts. I call into question my sexual activity, my sexuality, and my willingness to share with my partner the more intimate aspects of myself. The infection risks occurring when, for example, I have a new partner and my relation with him is very intimate. Chances are that I will be more open to love, sharing, and giving. This is new for me, and I need a little time to deal with this recent situation, even if Candida appears. Candida may also result from a feeling of having been humiliated or having been or felt sexually abused by someone. It is a form of physical and sexual protection, as the irritation prevents me from making love. This kind of statement I see a lot in my practice with women. That they really are not in a very loving or nurturing relationship and experience vaginal yeast infections on a regular basis. So what is irritating me so? I verify what inner aspect of my sexuality is upset, and I find the actual cause of the physical and inner irritation. Where does my frustration come from? Do I have the impression that I allow others to decide about my life? Will I take the risk of opening up to others, especially of the opposite sex? Or will I remain enclosed in my shell? Why do I feel left aside, yet sacrifice myself and still not take my place? I'm afraid of losing my naivety, my innocence, my pure side. So what would be the positive affirmation? It's about taking care of yourself, right? Setting clear boundaries. I accept to take my place in life by respecting myself. I must become the candidate, right? The word candidate and candidate, who will carry the victory and win first place. I take the time to see and assess what is going on and accept my love, my openness, my inner patience, as well as those of my partner. If you want to explore more about yourself, your wellness vision, what motivates you, and how to apply your strengths qualities in achieving the very best of you, then contact Medica Nova Wellness Coaching at health@medicanova.net for your 3-month coaching program. I'm coaching you to be well. So let's proceed with our natural protocols. Let's talk about some lifestyle changes first. Yeast can only multiply to harmful levels when the conditions are just right. We talked about moist and humid areas or environments. So make sure to wash the genital area with a natural soap every day and dry off the area well after showering, since fungi are most commonly found in moist environments. Following sexual intercourse, wash your vagina, or the man as well. Keep yourself clean. I also suggest wearing a loose-fitting cotton underwear or another breathable fabric here. Allowing air to reach your genital helps stop the moisture and worms from developing, which of course worsens the yeast growth. The main aspect here is boosting your immune system. So a diet that boosts your immune system can help your body stay healthy, reducing the risk of an infection, since an increase in protective white blood cells is able to target the problem before it actually worsens. So this is the reasons why a weakened immune system is one of the significant risk factors for recurring yeast infections. Support your immune system here by eating nutrient-dense diet, especially high in vegetables, bringing coconut oils, probiotics, I mentioned that already, and good quality sources of protein. When you start a protocol, I would say at the later stages, not at the beginning of the protocol, but at the later stages, include fermented foods, including dairy products like kefir, yogurt, kombucha, and kimchi, veggies. They all contain probiotic microflora that helps to protect the intestines, improve your immune system, and therefore fight the yeast. Why I say introduce this more at a later stage, because in the beginning your system wouldn't take it. It's just too overwhelming. So be gentle on your body with a Candida protocol. As I said, probiotics are good bugs, and that they compete with the harmful pathogens in your body and the good kind of bacteria that live within your body and on your skin. Basically, they compete with Candida yeast for the available food sources, and they usually win. So it's very important to create a good bowel flora, like good microbiomes in your body. But when it comes to your diet, make sure you have to control your blood sugar here, because high levels of sugar feed Candida yeast growth. Candida loves sugar, but sugar is not just, the little teaspoons of sugar you put in your coffee or your tea. It's in alcohol, it's in grains, it's in snacks, it's pretty much everywhere. Refined grain products, anything, conventional dairy products even in fruit, fruit juices. You have to keep it out. A good Candida program really emphasizes to leave out all sugar at least for 3 months. If you're allergic, right, to the latex of the condoms or to soap or other hygienic products, maybe bath oil, check your tampons, maybe any jellies or douches that can cause allergies. Be careful here. If you purchase feminine products, really keep them as clean and pure as possible. No fragrances, no chemical dyes, no harsh ingredients, none of it. You have to stay away with it. Douching, it's a controversial issue. I personally don't suggest it because it can affect the vaginal sort of natural balance and of the microbiome. So I would say stay away with it for the moment. Of course, if you suffer from hormonal imbalances, it's a big part here which can add to the vaginal yeast infection, especially the hormone progesterone. It can increase yeast infection in the vaginal area because it increases the production of glycogen, which is a natural starch that is converted into sugar easily. For example, if I need more energy, have to run after a bus or really move my body fast, glycogen is converted into sugar, via the liver here as well. And therefore the body has more access to ready-made sugar. Yeast can thrive off these starch molecules, and because women have naturally higher progesterone levels than men, they are more susceptible here for yeast overgrowth. As I said, men can develop yeast infections too, right? But because women deal with more hormonal issues, they are more prone to it, especially during the menstrual cycle, during menopause, taking birth control pills, I mentioned that already, or when the woman is pregnant. So in terms of supplements, I really would like you to introduce probiotics. They usually contain several strains of Lactobacillus acidophilus, bifidus, ideally between 50 to 100 billion strains would be really nice here. Bring in systemic as well as digestive enzymes. Digestive enzymes usually contain amylase, lipase, protease. So all enzymes is a catalyst which help to assimilate our food. Systemic enzymes contain more protease, even bromelain and papain. It's a source from pineapple actually, which help us to break down food, as well as help us to break the sludge of the carbs after we have eaten as well. I also would suggest to balance your pH within your body. So in the morning, take apple cider vinegar, a teaspoonful with a glass of lukewarm water. Again, that helps to balance the pH level. If that doesn't work for you, introduce it later, at a later stage in the protocol. If your liver is affected, I definitely would bring in, because of the glycogen situation, I would bring in milk thistle, dandelion extract, maybe boost your immune system with elderberry. But my first herb of all the herbs is podarco here. Podarco comes from the Amazon, and it really is helpful in dealing with issues associated with temporary immune disturbance. It boosts your immune system, but it's also a great antifungal agent here. Boric acid, you maybe heard about, is a safe alternative to some prescription medications for the treatment of recurring yeast infections. Of course, you want to bring in antioxidants, you want to boost up your immune system, and I would bring in vitamin C here, 1,000 milligrams at least 3 times a day. So I want to finish this video by sharing with you my most effective homeopathic remedies, which not only will stop the fungus from flourishing in the vagina, but also prevent the recurrence of vaginal candidiasis. Homeopathic remedies are completely safe and have zero side effects. They're made from natural substances and help to extract the disease from its roots by raising the body's immunity. And as the fungus gradually declines, so will be your symptoms. So please be aware, all these remedies which I share with you now, they're available at your local health food store or online, so nothing too complicated here. The idea here is to match your individual symptoms and expressions of your yeast infections with the most similar or alike description of the suggested remedies in this video. Right, so you want to find a match, not just an overall band-aid, but a very specific remedy for your individual symptoms. Now for potency questions, how many times to repeat these tablets, or if you need professional advice, please contact me at health@medicanova.net. If you want to learn more about homeopathy and how to use it for your family, loved ones and friends, as well as during the pregnancy, birth and postnatal period, plus get the best foundational skills in health and wellness coaching, learn all about integrative mental health and quantum healing and so much more, explore Medica Nova Online Academy for your certified master online courses at medicanova.net. Now these certified comprehensive home study courses will give you the best educational learning experience. So today let's talk about Sepia and Calacabonica 30. The number behind the name of the homeopathic remedy leads to the potency, the strengths. And over the counter you get usually 6 or 30, so 30 is fine. And here the keynote is, if you notice just the milky white vaginal discharge, right, when it curdles and it looks like cottage cheese, these are the two remedies you want to look at. Both Sepia and Calacabonica are top natural medicines for treating vaginal candidiasis, where the vaginal discharge is this milky white color. If you need Sepia, you will find excessive itching. You have excoriation in the vulva or the vagina, which is really raw by now, along with this milk whitey vaginal discharge. The itching is not relieved by scratching. There's soreness, there can be swelling of the labia or the vulva and the vagina. Because it's so sore, it feels even warm to touch the area. There can be heat. Irritation and stitches in the vagina also felt. It's definitely indicated when you feel pain during intercourse, right? During on coition, that can be very big aspect here. It's a very beneficial remedy for complaints experienced around the climacteric or menopausal period, and overall there is this bearing down pain in the womb. It's also a very characteristic keynote and guiding symptom here. Calacabonica comes more in when you have this white vaginal discharge, but it happens more on passing urine. So you go to the toilet or bathroom and you empty your bladder, and there you see the white discharge. The discharge is accompanied again with burning and itching in the genitals. That's worse before and after the periods. There can be again vagina and vulva. Maybe there's signs of swelling and redness. There can also be a history of heavy bleeding. That's part of this personality. So look out for that. But Sepia would be probably my first choice of remedies for a lot of women in general. Now, if the discharge is not just white, but thick and creamy, right? Not this cottage-like appearance, but this thick, creamy discharge, think about pulsatilla 30. Very indicated here. The discharge is accompanied again with burning or corrosive itching in the genitals. The vaginal discharge is experienced throughout the months, can be before, during, or after the periods. The discharge is also very accurate, but look out for these creamy textures. There can be backache. It's very common with vaginal yeast infection that women have backache. Apart from these particular features, some general symptoms is of high significance should be taken into consideration for using this remedy, and that has a lot to do with the personality. Pulsatilla women, they are very mild in nature, yielding position, and they start often to weep over minor issues. They feel better outdoor, but they're very sensitive, whereas the sepia personality is much more edgy, right? Can be very angry, especially before the periods. Don't want any sexual contact, leave me alone. Whereas pulsatilla is very, it needs company, right? It needs somebody who hold your hand and make you a cup of tea before your periods, during difficult and challenging situations in your life. Now, if you have excessive soreness and ulcers appear around your vagina, and of course you need professional advice here, but I just want to give you the idea that we have different symptoms with each vaginal yeast infection. We have two remedies called Tuha and nitric acid. It's that when there is extreme acridity, it means very acrid, very burning sensation here is present. There's vaginal discharge, scratching, and the ulcers begin to appear in the vulva, in the vagina. Then these two remedies are God sent here as well. Tuha is the ideal remedy when excessive excoriation, burning and smarting is felt in the vulva and vagina due to the ulcers. There's also discomfort and sensitiveness in the vagina during coition. Nitric acid comes in where we have almost like stitching type pain, right? Like needle-like pain, knife-like pain, and it becomes very unbearable. And the vaginal discharge is white with excessive soreness of parts that can be burning and itching are felt in the vagina. The discharge may even leave yellow stain in your underwear. Again, there can be even a stringy nature of the discharge, but here you need professional advice. I mentioned already sepia when you have pain or burning in the vagina during coition, during sexual intercourse. Think about sepia here as well. We have another remedy like a podium that I don't want to make it too difficult here. We also have remedies for curdy deposits in the vulva, right? When it's more of a, as I said, a discharge which is more curdy. Helonios would be a great remedy, but I don't want to go into it. I just want to mention it that, as I said, there can be different shades, right, and different grays of the vaginal yeast infection. I think I want to bring in one more remedy. You will not get that in your health food store, but you can order it online. It's called Candida albicans or Monilia albicans. It's literally made, the remedy is made from Candida albicans source, and it's really a great remedy if you have fissures or cracks in the vulva and the vagina. We call it a nosode here because it's made from the actual source. It's a powerful nosode and is used in the treatment of vaginal candidiasis with efficient results here. And the most important indication is the presence of cracks, right, or fissures in the vulva and vagina. Itching is always present. There can be marked swelling of the parts, and it's a great remedy, maybe an intermittent remedy, but when it goes into the cracks, then you need really more of an aggressive and intense protocol. Homeopathy offers, of course, many more remedies here for the itching of the vulva or the vagina, like creosote, medorinum, and so on. But I said here you need your professional homeopath to help you. So this video again was packed with useful information how to heal your vaginal yeast infection. Again, if you require an individual consultation, contact my practice at health@medicanova.net. And to stay updated with more ongoing videos, I appreciate if you subscribe to my channel, share and like it with your friends and family, and don't forget to click that bell which notifies you every time I upload a new video. So with all my heart, I thank you for your continued support of my channel throughout this really challenging year. I hope that these free educational videos inspire you to seek out natural and holistic solutions. And for more social media links, see the information below in the description space. Thank you also for all your donations. I really thank you from my heart. So from Medica Nova and Medica Nova Wellness Studio, I wish you all a very peaceful Christmas time and hopefully a joyful and a healthy new year. I'm going to take a break for the rest of the month of December as well as at the beginning of January, and I will see you, fresh and clear and ready to tackle 2021 around mid-January again. So till next time, much love and have a sweet and smooth transition into 2021.